An incarcerated hernia occurs when a part of the intestine or abdominal tissue becomes trapped in the hernia sac, unable to return to its original position. This condition is a serious complication that can lead to strangulation, where the blood supply to the trapped tissue is cut off, causing tissue death. Types of hernias that can become incarcerated include inguinal, femoral, umbilical, and incisional hernias. The causes of incarcerated hernia typically involve a combination of muscle weakness and strain. Factors such as heavy lifting, obesity, chronic coughing, or constipation can increase the risk of developing a hernia that may become incarcerated. Risk factors for incarcerated hernia include age, with older adults being more susceptible, a history of hernias or previous surgeries, and conditions that increase abdominal pressure, such as chronic obstructive pulmonary disease, COPD, or pregnancy. Symptoms of an incarcerated hernia can include sudden, severe pain at the hernia site, nausea, vomiting, and inability to pass gas or have a bowel movement. The hernia bulge may be tender, swollen, and not reducible, meaning it cannot be pushed back into the abdomen. Treatment options for an incarcerated hernia are primarily surgical, as this condition is a medical emergency. Non-surgical methods such as manual reduction are rarely successful and not recommended due to the risk of strangulation. Surgery involves an urgent hernia repair procedure to release the trapped tissue and restore normal blood flow. The surgery can be performed using open or laparoscopic techniques, depending on the hernia type and patient condition. Surgical management of an incarcerated hernia includes either open hernia repair or laparoscopic repair. Open hernia repair involves making an incision near the hernia site to access and repair the hernia, while laparoscopic repair uses small incisions and specialized instruments to perform the repair with the aid of a camera. Both methods aim to reduce the hernia, remove any non-viable tissue, and reinforce the abdominal wall to prevent recurrence. A nursing care plan for a patient with an incarcerated hernia includes preoperative and postoperative care, pain management, and patient education. Preoperatively, nurses should monitor for signs of strangulation, provide pain relief, and prepare the patient for emergency surgery. Postoperative care involves monitoring vital signs, assessing the surgical site for complications, managing pain, and encouraging early ambulation to prevent respiratory and circulatory complications. Nurses should educate patients on the importance of avoiding activities that increase abdominal pressure, proper wound care, and recognizing signs of hernia recurrence. In summary, an incarcerated hernia is a serious medical condition requiring prompt surgical intervention to prevent complications such as strangulation. Effective nursing care plays a crucial role in the preoperative and postoperative management of patients with this condition, ensuring optimal recovery and reducing the risk of recurrence. Subscribe us for more videos like this and visit bazarbiblio.com for notes and free PDF books. Thank you.